Here we'll talk about National Program for Control of Blindness. It is launched in 1976. The main aim was to reduce the prevalence of blindness from 1.4 to 0.3. Right? So prevalence is number of new cases occurring. Right? If you see the objective is what are we doing under this program, and strategy is something how are you doing it. If you see in the objectives, firstly 66 lakhs of cataract operations are conducted every year, 9 lakh free specs are distributed every year, and also 50,000 donated eyes are given for keratoplasty. Right? So if you see the strategy, how are they doing it? First of all, they are conducting this free cataract surgery. That is why many number of people are showing up for this cataract surgery, and also many NGOs, private sectors and government sectors are involved in it. So they are getting huge funds. That is why they are able to conduct this free cataract surgeries. And if you see 9 lakh free specs per year distribution, first they'll screen all the children present in the school, and whoever having this refractive error, they will be referred to ophthalmic assistants, and then they will provide the spectacles for the people below poverty line. Right? So they are conducting this school eye screening program. 7% of the children of age group 10 to 14 years will be having this refractive errors. So first, the trained teachers in the school will screen the children for any refractive errors. If they are able to find children who are having this refractive errors, then they will refer these children to the ophthalmic assistants. They will be providing spectacles to the children of below poverty line. So this is how they are distributing this 9 lakh free specs every year by screening. And coming to the third point, which is 50,000 of donated eyes are given every year for this keratoplasty surgery. So it is all because of this hospital retrieval program, and also motivation from the people, motivation speeches, all this pushes forward the people to come and donate their eyes. So 25th August to 8th September, it is the eye donation fortnight. So for the 15 days, it is an eye donation fortnight. This hospital retrieval program plays a major role in this keratoplasty for the donated eyes and all. Right? And coming to the second point, which is decrease in avoidable blindness. How are you going to decrease it? By screening the people above 50 years of age and organizing these eye camps, and by conducting operations. If any cases which need surgeries, then they'll shift those people to the fixed facilities. That means they'll take the people to the hospital and conduct operations. So this is how they are decreasing this avoidable blindness. Coming to the third point, where this eye health for all is a strategy, we are strengthening this strategy by provision of comprehensive universal eye care services. Right? For everyone we are providing eye health, so that is like comprehensive services. How are we doing it? Again, by capacity building. Capacity building means employing the people in this field. This is how we can strengthen our strategy of eye health for all, and also improving the knowledge and skills of that people, which increases the quality of the services provided. And also Regional Institute of Ophthalmology are upgraded to Center of Excellence. How are they doing it? Again, by bringing the newer equipments into the regional institutes, and by training the manpower present there and providing this quality services. So by bringing equipments, training the manpower, they are converting this Regional Institute of Ophthalmology into Center of Excellence. Right? Coming to the next point, strengthening the existing infrastructure and providing high quality comprehensive healthcare. How are they going to provide this high quality comprehensive healthcare? By not only focusing on this cataract, but also focusing on other diseases like diabetes, glaucoma, corneal transplant, childhood blindness. All these newly emerging diseases are being focused here. Right? So by this they are providing this comprehensive eye care, complete eye care, not only because of cataract but also because of other diseases like diabetes, glaucoma, corneal transplant, etc. And coming to the next point, which is community awareness. So it is by again IEC, information, education, communication. So they are providing this community health education by providing the regular eye checkups and providing vitamin A prophylaxis program and services facilities in the rural areas. So they'll go to these rural areas every now and then. They'll do this eye checkup, and also they provide this vitamin A prophylaxis. So that is how they conduct this community health education. They'll also teach the importance of eye checkups and vitamin A and all. Right? So that's how they provide this information, education, communication. They spread the awareness. And coming to the next point, research. It is also an objective. Under this program of National Control of Blindness, we are doing research. Once we know more about this blindness, we can treat as many cases as possible, right? And coming to the 8th point, securing private practitioners and voluntary organizations. So not only the government but also the private institutes and voluntary organizations will help us financially, right? So once we are having this cash assistance, we can conduct as many camps as possible, we can treat as many cases as possible for free cost, right? So that is why public-private partnership is there. So that is the strategy. Now coming to the organizational structure of this program, coming to the administration, you have at 3 levels. One is central, state and district. In the district you have district blindness control society. In the district you have the society, blindness control society. In the state you have state ophthalmic cell. In the central you have ophthalmic section, which is maintained by Ministry of Health and Family Welfare. right? If you see the services and the delivery provided by this administration, service delivery and the referral system, you have in the 3 stages again. One is tertiary, second is a secondary, and the other is a primary. At the primary, you will be having link workers, panchayats, and also PHCs, CHCs, sub-district hospitals and all, right? And at the secondary stage, you will be having district hospitals and NGO eye hospitals. In the tertiary, medical colleges, center of excellence, regional institute of ophthalmology, all this will be coming under tertiary services. So what are we doing under this? First, write about this number: 66 lakh or cataract operations, 9 lakh specs, and 50,000 donated eyes for this keratoplasty. And then write about ABC. A stands for awareness, IEC program, and B stands for blindness, avoiding blindness cases by screening people, and C stands for 3 things. One is comprehensive eye healthcare. Again, under the comprehensive, you have to write about 2 things, right? So one is capacity building, people and all, and then write about these diseases, not only focus on cataract but also focus on other diseases. And then we'll write about center of excellence, and then write about the last 2 points, which is research and public private partnership. This is about it. Bye.